So I'm going to go ahead and do that. And now that I have it instilled, and you could have done this before we unhooked it if you wanted to, but I'm able to maneuver with this. Without pulling on the tube, I'm going to go ahead and take that loose and re-put the anti-reflux valve in there, and I'm going to put this back over here to the side. I'm now ready to pull the tube out. I want to make sure that I've got the bag up here close. So when I'm ready, I'm going to have him take a deep breath, okay, and hold it. And then I'm going to pull the tube out, and you don't want to prolong it, because if you do this and prolong it, it can be very uncomfortable and it can irritate the back of the throat, and it could potentially make him throw up. Once I pull it out, I want to pull the waterproof drape down over it so the patient is not looking at the tube and seeing the secretions and all that stuff, because that can encourage nausea and vomiting. If he needs the emesis basin, I have it here for him, but he's tolerating it very well. Anytime you pull anything out of your patient, you always want to make sure that the tip is intact, because you want to make sure none of the equipment is left inside of the patient. So I need to make sure and assess it before I get started. The tip is intact. I'm going to go ahead and roll this tube up, and I'm going to put it into the red bag. I probably have gastric secretions and things all over my hands at this point, so I'm going to go ahead and take these gloves off, and I'm going to foam. I'm going to put the rail back up to provide for safety for him. And in the meantime, I'm going to put on another pair of gloves here so I can finish cleaning up everything. I always need to make sure that I'm keeping an eye on my patient to make sure that I'm not having any issues here, that he's not having any trouble breathing, respiratory distress, any of those kind of things. Again, remember your hands are probably sweaty or wet from your foam again. I'm going to go ahead and put these on. And I'm probably going to go ahead and wrap the red bag up and put it over here on the table until I can go dispose of it appropriately. I'm going to wrap up his waterproof pad, and I'm going to dispose of it. If there were any secretions in the emesis basin, certainly I would need to dispose of those. He doesn't have anything, so I'm just going to sit it here for right now. I'm going to take these back off. I'm going to go ahead and foam my hands again. I'm going to put his bed down. And at this point, he no longer has his NG tube in, so I could potentially lay his head a little bit flatter down, but immediately after pulling the tube up, I like to leave them up for semi-Fowlers at least long enough for me to make sure they're tolerating it, that they don't get sick. I usually do leave the emesis basin close by just to make sure they're not having any issues, because they could have very well had irritation in the throat from the pulling of the tube. I would go ahead and go through and again assess his nares, make sure he doesn't have any breakdown or any of that. I would go ahead and assess his mouth and provide mouth care per policy. I would go ahead and again reassess the things that I had done before I started. I would need to make sure that his bowel sounds were active, that he doesn't have any distension, no nausea and vomiting. Make sure and note all of that whenever I document. Make sure how he tolerated the procedure. He didn't have any drop in his pulse ox whenever we were going through and doing this. And then again address the 4 P's. So is he in any pain? Does he need to be repositioned? Does he need to potty? And at this point, he doesn't have a tube, so we shouldn't have anything that would limit movement unless his orders say that. And then proximity, I need to make sure his call bell is there. Once I clean the table, I need to bring the table back over here. Again, I need to make sure the bed is in the low and locked position and that it's not moving. And then before I leave the room, I need to thank Mr. Smith for allowing me to care for him today and give him some instructions of things that could end up that he could have issues with. So certainly if he starts complaining of nausea or vomiting, if he starts having increased abdominal pain, any distress, trouble breathing, make sure he rings his bell and lets me know. And I need to make sure and keep up with all of that stuff as I'm going through and doing these things. Again, I need to account for any intake or any liquid that I instilled, and then I would need to clean up the canister and account for that in the output as I was doing that. Thank you very much.